Yeah.
You have, you've got a series of trials under your belt under the Disrupt CAD and things like that. One of our big cornerstones and one of our really big problems is the protruding calcium or the calcified nodule.
Yeah.
Tell us more about it. What is the experience and how has IVL shaken that world, really? Has it rocked it?
Absolutely. Yeah. Or it's broken it into lots of little rocks.
That's right.
It definitely has, because whilst we've been understanding how calcium grows and how the pathogenesis, this is what I was talking about.
That's right.
Intravascular imaging, I think, has given us some information, but we've also learnt to read more effectively the behaviour of our other tools. So eccentrically expanded balloons, what does that mean? What does it look like when you have a calcified nodule which is, hollow on the inside, so a necrotic core, which will, even with a regular non-compliant balloon, may just collapse down. What we've learned is that there are different types of nodule and different types of eccentric calcium, and I would caution people against using, when you have a thick protuberant nodule with deep solid calcium in the wall, is to go anywhere near that with any high pressure device. Right. So barotrauma, I think, and the risks of, OPN balloons in that situation it's the wrong approach. Right. I agree it may well work for concentric calcium, but if you look at when you're treating eccentric calcium with a non-compliant balloon, all you're doing is creating the adventitial stretch, exactly. and you're tearing at the edges. So I think what we've seen, and the data is really very clear, and there is a consistent message that irrespective of the calcium morphology, whether it's concentric, eccentric, nodular, that the efficacy of IVL in terms of your final MSA there is really relatively little difference. So having IVL in these large vessels with eccentric nodules, I think can be a sole therapy, but it can also be used in combination with atherectomy.
Right.
And it may be that for a small percentage of cases, that's probably why we have to retain our skills in rotational atherectomy.